Here's a table summarizing the overview of acyanotic CHDs, along with associated conditions and risk factors. Acyanotic CHD description, associated conditions and risk factors. Atrial Septal Defect, ASD, defect in the interatrial septum leading to an atrial left-to-right shunt and RA and RV volume overload. Down syndrome, fetal alcohol syndrome, intrauterine infections, e.g. torch. Ventricular Septal Defect, VSD, defect in the interventricular septum causing a ventricular left-to-right shunt and RV and LV volume overload can lead to pulmonary hypertension. Maternal diabetes, Down syndrome, intrauterine infections, e.g. torch. Atrioventricular septal defect, AV, variable deficiency in atrioventricular AV septa, potentially causing an AV left-to-right shunt and AV valve regurgitation. The complete form is associated with pulmonary hypertension. Down syndrome, patent foramen ovale, PFO, persistence of the foramen ovale cordis after 1 year of age. Often asymptomatic, but may precipitate embolic strokes in adults or be diagnosed incidentally. May be associated with other congenital heart diseases and syndromes, e.g. Loeys-Dietz syndrome. Patent ductus arteriosus, PDA, postnatal persistence of the ductus arteriosus leading to a left-to-right shunt from the aorta to the pulmonary artery. Fetal alcohol syndrome, congenital rubella, Down syndrome, coarctation of the aorta, narrowing of the aortic arch, causing LV outflow tract obstruction, collateral circulation, differential blood pressures, and distal systemic hypoperfusion in long segment coarctation. Turner syndrome, pulmonary valve stenosis, narrowing at the pulmonary valve leading to RV outflow tract obstruction and RV hypertrophy. Congenital rubella. This table encapsulates key information about various acyanotic congenital heart defects, their characteristics and associated conditions or risk factors, serving as a concise reference. Below is a table comparing the common features of ventricular septal defect, VSD, and atrial septal defect, ASD, based on the provided information. Feature, ventricular septal DSD, atrial septal defect, ASD, Down syndrome. Epidemiology, most common congenital heart defect. Third most common CHD. Etiology, Holt-Oram syndrome, intrauterine infections, e.g. torch, Down syndrome. Maternal diabetes, Down syndrome, fetal alcohol syndrome, clinical features, small defect, usually asymptomatic, clinical features, medium to large defect, failure to thrive, recurrent bronchopulmonary infections, exercise intolerance, congestive heart failure, exertional dyspnea, fatigue, recurrent bronchopulmonary infections. Auscultation, harsh holosystolic murmur over the left lower sternal border. Murmur typically louder in small defects, mid-diastolic murmur in case of pulmonary hypertension, systolic ejection murmur, widely split second heart sound, S2, over the second left intercostal space, IC fixed. Normal ECG findings. ECG medium to large defect, signs of LV hypertrophy, signs of RV hypertrophy, possible supraventricular arrhythmias. Echocardiography, pathological left to right blood flow, interatrial communication. Enhanced pulmonary vascular markings, left atrial and ventricular enlargement, later stages, enlarged right ventricle and pulmonary artery, enlarged right atrium and ventricle, enhanced pulmonary vasculature. This table provides a side-by-side comparison of VSD and ASD, including their epidemiology, etiology, clinical features, diagnostic findings on auscultation, ECG, echocardiography, and chest X-ray.